Hi guys, it's Michelle with Traybell Recovery Care, and I'm coming to you today just to talk a little bit about how do you plan for your surgical procedure. Your best bet is to start planning early, to start planning before, well in advance of a couple of months, probably before you actually have your procedure. One of the first things that I will say is the main thing that you need to have in place is a support system. You need to know that the people who say that they're going to help you are going to be able to help you. You need to confirm, you need to reconfirm, you also need to have a backup plan. Because a lot of times what my clients will tell me is, oh, well, my sister said she was going to fly down and help me, but something happened for her in the last minute. So, okay, it's like, well, what's your backup plan? So you need to make sure that whoever says that they're going to come down, that you confirm it, you confirm it, you confirm it all the way up until the day of your surgery, and you make sure that they're going to be able to be there to help you. Because too many times we feel like that we can rely on people, and in the end we find out that they're unreliable. So that's the first thing. You need to make sure that your support system is in place. If you don't have a support system, you can always reach out to us and we will take great care of you and help you heal and help you recover as in the best way possible for the surgery that you've had. The next thing you need to do is to make sure that you have all of your toiletries, things like your lotions that you use, your deodorants that you use, toothpaste, feminine products, any medications, any prescriptions, anything that you know that you use on a routine basis, you need to have a stock supply of that. And the reason I say that is because a lot of times clients will say, well, I thought I was just going to be down for a day or two. That's not the case. You are going to be down if you're going to have some cosmetic surgery, if you're having a BBL, a tummy tuck, breast enhancement, even lipo. More than likely, you're going to be down several days, especially if it's a procedure that you go under general anesthesia for. If you go under local anesthesia, maybe a day or two you'll be down and you'll be pretty much back to normal, maybe just some soreness or what have you. But a lot of the times my clients will say, well, I didn't know that it was going to be this painful. I didn't know that it was going to be that big of a deal. Yes, it's that big of a deal. Anytime that you have surgery and you go under general anesthesia, it's a big deal. So don't expect to be able to recover within a day or two. It's not going to happen. I promise you. You need someone there. If you're having a tummy tuck, BBL, breast enhancement, you definitely are going to need someone there with you that first week. And for the first 3 days, I would say around the clock. And after that, then they can kind of taper off and just be there to kind of help you out as needed along the way. So make sure that you have a backup plan. A backup for the backup plan is what I always say. Next thing, comfort items, things like dark sheets. You're going to want to have dark towels just to make sure that you don't end up having stained sheets with blood and all of that kind of stuff. No one wants to lay on that. No one wants to look at it. You're not going to be able to wash constantly. You're not going to want anyone else there washing constantly around the clock. So just make sure that you have dark items, that you have pads to put on the bed to keep from draining on the bed, that you have a large water container so that you'll be able to track the amount of water that you drink, because that's going to be very important. Some of the other things that I recommend when it comes to foods, you're going to want to have low sodium items, things that are not going to increase the swelling, and low sugar items, things that are also going to keep the swelling from increasing, because you're going to be swelling as it is just from the surgery. So you're certainly not going to want to have foods that are going to increase that swelling. Low sodium crackers, I recommend things like low sodium cheeses, goldfish crackers, low sodium saltines, wheat thins, things like that, yogurt, soups. I tend to go for more of the organic soups that are, I think Whole Foods carries a lot of them that are low sodium organic soups. And you can also find them in the grocery store too. Things like popsicles, brown rice, the quick brown rice, not the one that takes 40, 50 minutes to cook, because you nor your caregiver is going to want to spend 40 minutes in the kitchen cooking brown rice. Um, Other things that you're going to want to have is make sure that you have enough water on hand. I always recommend the pH balanced water and the coconut water. To me, coconut water is much better than just having regular water, because coconut water is going to replace some of the electrolytes and some of the enzymes and things that we miss during surgery, or that we lose during surgery, and it's going to rehydrate you much faster than regular water will. When it comes to all of the Gatorades and all of that stuff, don't bother wasting your money to buy it. That's just my opinion, and that's what I see that works with my clients. One of the other things that we recommend is for your medications, that you make sure that you get your medications and your prescriptions filled ahead of time. If you have something that's, maybe you have less than a 2-week supply, go ahead and get it filled. It just cuts down on the amount of times that you have to find someone to go back and forth to the pharmacy and to the store and all that kind of stuff. Lastly but not least, because we're all beauty warriors, so we're all trying to make sure that we look as best as possible. Make sure that you get your hair done, you get your nails done, you get your pedicures, all that stuff beforehand, because it's going to help you feel better. Once you've come through your first couple of days, you should not be in a place where you're worried because, okay, well, my hair is looking crappy or my nails look horrible. So just go ahead and get it done ahead of time. So those are a few of my tips for plastic surgery recovery, plastic and reconstructive surgery recovery. So if you have any questions, you can feel free to inbox me. You can go to my website, www.traybellcare.com, or you can call me, 678-404-6359. Thanks.